actually not studies based on any, this doesn't imply that any wrong diagnoses are being made in India. That actually studies, those are international studies across the globe. The wrong diagnosis or the diagnosis requiring a change, that is nothing new actually. The complex medical conditions or surgical conditions can be very complex to diagnose and to treat. Sometimes it requires multiple set of eyes and multiple different experts to get to that point. The whole point of this showing this data is that sometimes when the medical conditions are complex, for example stage 4 cancers, a lot of the times there is no straight answer. A lot of the times you need a second opinion, and that is the gap that we're trying to fill. That if you need an extra set of eyes and if you need an extra, you need an expert opinion from a different part of the world who's also been doing this in a different clinical setting, we are here to provide that service for you.
Thank you.
And the second question that you mentioned about the price points, we actually priced this service like we mentioned. It's a relatively cheap compared to any other similar service that's being provided by any other company in India for this level of service. So we think our price point is fairly competitive, and given even the Indian prices for healthcare these days, we think we are in a sweet spot where we can actually cater to much bigger population rather than just catering to very few people who can afford higher prices. That was the whole point, that we wanted to keep the prices on the lower end.
So is there stress